Hi, Dr. Windisch from Sparks Pediatric and Adolescent Medicine again here for our educational series for parents. This video might be useful for some medical professionals as well, depending on what you do for a living. Please remember that these videos are not to be done in place of or watched in place of seeing your physician or your healthcare provider. If you have concerns about your health or your child's health, please make an appointment to be seen. We can be reached here at our office, area code 775-359-7111. We'll get you in same day, even as a new patient if we need to. What we want to talk about today is care of the premature infant and what makes it different from adults or from non-premature infants, and why does your doctor seem to be doing things so much differently for this baby who's preemie as opposed to your non-preemie baby. And there are a lot of things that we do differently, so it's important to understand. The first thing I want you to understand, preemie babies, going back to 1970, if you were born more than 4 weeks early, that was considered touch and go. And going back into the 1960s, many of those babies died. Babies born 8 weeks premature in 1972 were touch and go. They were cutting edge medicine, full court press to keep alive. So if your baby's born more than 4 weeks early, you need to remember, we get kind of cavalier about our medical successes here in this world. But you do need to remember, your child really is $1 million baby and 30 years ago might have died. So we gave the baby the full court press in the hospital. We brought all of the best services together to keep your baby alive and healthy. But just because you've left the hospital doesn't mean that hard work comes to a screeching halt. It's going to continue for the first couple of years of life. So what are some things we do differently for our preemies? Well, the first thing we do is we see them much more frequently. Weight gain is very difficult for the preemies and is critical to make sure is going on. So depending on how preemie the child is, we may see your child twice a week for a couple of weeks. And that's important until we've established good growth. And then we can slowly start to cut back, but they won't be placed on a normal well-visit schedule right away. Your preemie definitely needs to get a flu vaccine starting at 6 months of age. The first year we do 2 vaccines and then 1 vaccine every year after that, and that vaccine needs to be done every year for the rest of your life. Ex-preemies are at high risk for respiratory disease, and respiratory disease is the #1 reason that they get readmitted at the hospital. It's also the #1 reason that a former preemie dies, so preventing respiratory disease is critical. If your child is extremely premature or has other respiratory or cardiovascular problems, then the child may qualify for a medication known as Synagis. This is a vaccine of antibody to prevent a disease called RSV, and specifically it's a respiratory disease. It is the respiratory disease most likely to kill an ex-premature infant. So it's critical that if your doctor recommends these vaccines, you receive them because they are absolutely life-altering for the preemie. Feeding is a big deal. Preemies, or babies in general, receive the majority of their calcium, iron, and protein stores in the last 90 days of gestation. If you are born premature, you're shortchanged on those 3 things. Because of that, we recommend preemie formula for all ex-preemies, and we recommend it until they are a year adjusted. That's 24 weeks. Let me do the math. 22 weeks 22 months post-conceptual age. It takes 10 months of conception for a baby to be born. I know everybody thinks pregnancy is 9 months. It's actually 40 weeks, 10 months. Okay? So 10 months for the baby to be born and 12 months of life. So at 24, once again, I can't do math. At 22 months post-conceptual age, you can come off the preemie formula. Until then, it is critical. Preemie formula is higher in calcium, it's higher in protein. Iron is another problem. These babies are all shortchanged on iron. If your baby was very premature, might have required iron transfusions in the form of a blood transfusion in the newborn intensive care unit, or your baby might have been placed on a medicine to stimulate bone marrow growth called erythropoietin or EPO. Or epigen. We still need to include the iron, the routine iron in your diet, okay? And that again needs to be done until your baby is about a year of age. These babies are also at risk of vitamin deficiency, so we usually put the babies on a polyvitamin with iron. Here in Nevada, because there's no fluoride in our water starting at 6 months of age, we change to a multivitamin with iron and fluoride. But maintaining that iron for the first year post-conceptual age So again, 22 months post-conceptual age is going to be very important because your iron stores are low. Preemies, when they get sick very quick. So if your baby is a preemie and has a cold, chances are your doctor's going to want to see you, maybe even the same day. These babies don't bounce back as quickly as term babies. So if your baby has a cold, we may see your baby daily, whereas your other baby, when he had a cold, we were much more cavalier about that and said, hey, we'll just see if you're having problems, or we see the baby once and say, come back if things aren't better. We may see this preemie daily, depending on how preemie you are, how bad your baby's lungs are. Ex-preemies are at risk for problems with the eyes. Depending on how early they were born, we may have you follow up with an eye doctor. If that is a recommendation that your doctor makes, make absolutely certain you see that doctor. That eye doctor needs to be a pediatric ophthalmologist. Optometrists are not capable of doing the exams that we need done for these babies. As an ex-preemie, your baby may come home on monitors, may come home on oxygen. If your baby does that, it's important that whatever follow-up your doctor recommends be followed closely. Those babies are seen very regularly in the office, and many times follow up with pediatric lung doctors, pulmonologists as well. Preemies are at risk to stop breathing. We may send your baby home on an apnea monitor and maybe even home on medicine for apnea. If you're on medicine for apnea, don't stop that medicine without talking to your pediatrician, and make absolutely certain that you don't miss follow-ups, because again, these medicines are very important, and stopping them early can result in problems like stopped breathing or low heart rate. Ex-preemies have problems with acid reflux. Your baby may need to go home on medicine for that, or we may be starting that early in the first couple months of life. And there are a variety of medicines that we might use for that, and sometimes preemies need to see stomach doctors for that, called gastroenterologists. As an ex-preemie, your baby is, especially depending if they're really preemie, in the newborn intensive care period, they're at risk for having some problems in their brain. Your baby may be sent home with follow-up with a neurologist. This is very important, not to be missed if that follow-up was recommended. You want to see a pediatric neurologist, and you want to follow with them until they tell you don't need to be followed anymore. If your baby is recommended to see a pediatric neurologist, it's because your child is at risk of having seizures, brain damage, mental retardation. So following up with that expert is very important. Finally, preemies tend to be developmentally delayed. Developmental delay many times can be fixed, but it requires aggressive physical, speech, and occupational therapy. If your child is preemie, they may qualify for services from the state called an Individualized Family Service Plan. Here in Northern Nevada, that's through a group called Special Children's Clinic. In California, it's through a group called the Regional Centers of California. If your doctor recommends follow-up with regional centers or with Special Children's Clinic, it's critical that you make an appointment with them, that you go for those appointments, and that you receive the services that you qualify for your baby, so that we can bring your baby and bring your baby up to date and keep your baby developmentally appropriate. Again, we spent $1 million getting your baby out of a hospital safely. The goal is to now make sure that your baby has a normal life. There's no point in saving the baby's life only to leave them to die from respiratory disease, malnutrition, become brain damaged, have seizures, or be developmentally delayed. So all of these services, yeah, they're intensive, but they're there for a reason, and that's so that we can have as normal a life for your baby as possible. And many of these children with aggressive services grow up to be completely normal adults, but it's going to take work. I hope this has helped to kind of demystify some of the hocus pocus about what we're doing and why we do it. These things are very important for your baby. Don't shortchange your baby. Give your baby all that he or she needs, and we do that with appropriate food, appropriate vitamins, appropriate follow-up with specialists, including the developmental specialists. If you have questions or concerns, we're happy to see you here in our office, area code 775-359-7111. We'll get you in same day if we need to. This is Dr. Kevin Windisch from Sparks Pediatric and Adolescent Medicine. We'll see you next time.